Well, welcome to the Medicare Benefits Overview. My name is Bill Rowe. I work with Covenant Medicare, and we have partnered with Integrity Marketing Group and PriMed Physician Group to offer this information to you. And what we're going to discuss today is who is eligible for Medicare and what are the coverage options that are available to a beneficiary. So a person eligible for Medicare is a U.S. citizen or a legal resident who has been such for 5 consecutive years, as well as that person needs to be 65 or older or younger than 65 with a qualifying disability, and any age with a diagnosis of end-stage renal disease or Lou Gehrig's disease. Your Medicare coverage choices are step 1 would be to enroll in Original Medicare, and step 2 would be decide if you need additional coverage, and there are 2 ways to get it. So we'll spend some time discussing those options for you. So first of all, we'll go into what are the parts of Medicare in detail. You have Medicare Part A, which is your hospital insurance that covers inpatient hospital care, inpatient mental health care services, skilled nursing services, hospice care, and some blood transfusions. Medicare Part B covers physician services, outpatient hospital services, ambulance, outpatient mental health, laboratory services, durable medical equipment, including wheelchairs and oxygen, outpatient physical, occupational, and speech language therapy, and some preventative care. So what is not covered under Original Medicare? You have the Part A and Part B deductibles, coinsurance and premiums, Medicare Part B excess charges, which are charges billed in addition to what Medicare agrees to pay. In Ohio, providers are not allowed to bill more than Medicare agrees to pay. Prescription drug coverage is not covered under A and B, but under Part D. Additional benefits such as preventative hearing, vision, and dental, and long-term care or custodial care is not covered under Medicare. Most nursing home care is custodial care. So the Medicare Part A hospital costs are, the premium for Medicare Part A is $0 a month for most people. Most people have paid into the system for their working life and have acquired enough quarters to qualify for a $0 premium. You then have a $1,408 deductible per benefit period for up to 60 days. Once you move into days 61 through 90, there's a per day cost of $352 per benefit period. And then once you move into day 91, you have a maximum of 60 days of lifetime reserve days, and those are at $704 per day. So of note, there are no out-of-pocket limits in Medicare Part A, and there are no out-of-pocket limits in Medicare Part B. And so Medicare Part B's premium is $144.60 for most people. Some people will have less, and some people have more, possibly depending on income. And then you have a $198 deductible for Medicare Part B, and then you have coinsurance of 20% of the approved amount for most covered services. And most people are uncomfortable with the no limit on the costs that they could incur. And so you can typically go down one of 2 paths to cover the other costs. So you have a Medicare supplement plan that you can add to Original Medicare, as well as a prescription drug plan, or you can opt into a Medicare Advantage plan. So first of all, we'll go over Medicare supplement and Medigap plans. These are offered by private insurance companies, and you would pay a monthly premium for your Medigap policy in addition to the monthly Part B premium that you pay to Medicare. And the plans are standardized. Plan designs must be exactly the same between insurers, and only the premium may vary. So for instance, if you had a Medicare Plan G with carrier A and carrier B, the plan is exactly the same. The only difference would be what the cost is. Eligibility for Medicare supplement plans, you generally must be enrolled in Medicare Parts A and B. You must be a resident of the state in which you are applying for coverage. You must be age 65 or older, and people of any age with end-stage renal disease. Of note, Ohio residents under age 65 are not eligible for Medicare supplement plans. Medicare Part D helps with the cost of prescription drug plans. This went into effect in 2006. Medicare Part D is only offered through private insurance companies, and you must continue to pay your Medicare Part B premium. There is a Medicare Part D formulary. The formulary is simply a list of drugs that are covered by the insurance plan. Many plans have a tiered formulary where drugs are divided into groups or tiers, and in general, the lower the tier, the lower the cost. Medicare prescription drug coverage varies from plan to plan. Catastrophic coverage protects you from the very high drug costs, and the benefits can change from year to year. You want to make sure that you enroll in a plan that covers the prescriptions that you take. And so you want to review the list of drugs that each plan covers. And just be aware that the list of drugs and the cost or the tiers can change from year to year. So coverage is not automatic, and there may be penalties if you enroll late. Your Medicare Part D prescription drug coverage, the amount you pay for prescriptions may change over the year. Here's why. Medicare Part D plans have 4 different coverage phases. They have an annual deductible stage, an initial coverage stage, coverage gap, and the catastrophic coverage. The amount of money you pay depends on the stage that you're in, and that can change throughout the year. Many people will stay in the initial coverage phase for the whole plan year, but if you take a lot of medications, especially high cost medications, you may move into the next stages. And then the cycle begins on January 1st of each year. So this chart shows the different stages of the prescription drug plan. That you are in, start off in the deductible stage, and the deductible will vary from $0 to $435 depending on your plan. You will then move, once you have, then move from the deductible phase into the initial coverage phase, where you will pay copays based on the tier of the medication. Once you've reached $4,020 of retail drug costs, you will then move into the coverage gap, and you'll be paying 25% of the generic prescription drugs and 25% of the brand name prescription costs up until the time that you've reached $6,350 of out-of-pocket cost. At that point, you move into the catastrophic phase, and you will pay a 5% coinsurance, or $3.60 or $8.95 copay for covered prescription drugs, whichever is greater. Again, we have 2 options to supplement, to go with original Medicare. It'd be add a supplement plan to supplement Medicare and a prescription drug plan, or option 2 would be to choose a Medicare Advantage plan. So a Medicare Advantage plan is you're combining Medicare Part A and Part B, in many cases including prescription drug coverage. So these plans are often called MAPD, Medicare Advantage Prescription Drug Plans, and they're offered by private health insurance companies, and they often include additional benefits like routine vision care, hearing care, wellness services, and nurse phone line support. To be eligible for a Part C plan, you must be enrolled in Medicare Parts A and B, and you must live in the plan service area. And eligibility is not affected by health or financial status. Plan premiums and terms can change from year to year. You must continue to pay your Medicare Part B monthly premium, in addition to any costs from the insurance company for the plan. It's convenient that you have a single plan that covers the medical portion and the prescription drug portion. And coverage is often limited to a service area unless it's an emergency. And you may be required to see doctors and hospitals that are included in the plan's network. And you may offer additional benefits not covered by Medicare, like we mentioned, preventative dental, vision, and hearing coverage, as well as preventative care. There are various types of Medicare Part C plans. There's coordinated care plans, health maintenance organization or HMO plans. Those plans offer a list of doctors, and you need to stay on that list of doctors for coverage to be adequate, to be covered. Preferred provider organization plans, PPO plans, which allows you to have coverage outside of the list of doctors. Special needs plans, HMO or point of service plans. And then other types of plans are private fee-for-service plans or medical savings account plans. So when can I enroll? So currently we're in the middle of annual election period. That runs from October 15th until December 7th for a January 1st start date. So if it is during this time that if you want to switch plans, now is the time to complete the paperwork to do that. And the last application that's entered will be the plan that you have for January 1st. Then there's also what's called the initial enrollment period, and you enroll when you become first eligible. There's a 7-month period that starts 3 months before you turn 65. It includes the month you turn 65 and adds 3 additional months after you turn 65. Be aware that coverage will typically start on the first of the month following your enrollment, or the first of your birthday month. And then there are special election periods. You can enroll or switch plans due to special circumstances, such as if you were to move from one county to another, that would cause a special election period. And the effective date would generally be the first of the month following enrollment. So now I'll open it up for questions. Thank you for participating and joining us, and look forward to any questions you may have.